Hi, I'm Nicole Aaronson. I'm a pediatric otolaryngologist, also known as an ear, nose, and throat surgeon. And because it's summer, I would be remiss to not talk to you about swimmer's ear today. So, swimmer's ear is also called otitis externa. It's an infection of the ear canal skin. It can result in the ear itself being very swollen. The ear canal itself is typically swollen and red, and there can be drainage, which can look thick and yellow to white. The ear itself is usually extremely tender. If you pull on the child's ear, it's usually excruciatingly painful. Now, I always tell families you cannot give your child a middle ear infection from getting water in their ears when they have an intact eardrum, and that is true, but getting water in your ears can give you swimmer's ear. So there are some kids who are just prone to swimmer's ear for some reason. I see them in my office year after year in the summer after they've been swimming with swimmer's ear. And there are some kids who never get swimmer's ear. And I was that kid who always got swimmer's ear as a kid. And as an adult, I've never gotten swimmer's ear. So sometimes they grow out of it. It may be something with their kind of microbiome of kind of helpful bacteria that we all have on our skin surface that changes for them over time. But swimmer's ear, while excruciatingly painful, is still treatable. Usually the first line treatment for swimmer's ear is ear drops. Often we start with Cyprodex drops. Sometimes there can be a fungal component and we have to use different drops for that. Sometimes if the ear canal is very swollen, we have to place something called a wick, which is sort of a short cotton piece that is placed in the ear and kind of allows the eardrops to travel down the wick and get farther in than they would get if they were just placed on the surface of a swollen ear canal. I always tell my patients that the most important thing for treating swimmer's ear is oral toilet. That's A-U-R-A-L, not O-R-A-L. So ear toilet, which basically means suctioning out the goo so the drops can get in and do their work. And sometimes we have to do that a couple times in the office before it's all cleared up. Sometimes if someone has particularly resistant otitis externa, we have to consider other things like gentian violet dye or other topical powders. But for the vast majority of garden variety or swimmer's ear, it will clear up with a course of antibiotic drops relatively quickly, although maybe not quickly enough for a kid who's in pain. People who get recurrent swimmer's ear can consider things like headbands or earplugs that keep the water out of their ear. They also might consider using a little bit of diluted rubbing alcohol in their ear canal after swimming to kind of help the water in the ear canal to evaporate. Of course, all of this is only true for kids who have intact eardrums, so that's kids without holes in their eardrums or without tubes. Using rubbing alcohol on a kid with tubes in their ear would probably be quite painful. As always, if you're concerned about your child's ears or if they're not getting better, you should see your pediatrician. But swimmer's ear will probably happen to some of you this summer and will probably be resolved with a course of antibiotic ear drops. Thank you so much for listening. If you enjoyed this video and you'd like to see more, please subscribe to Dr. Nicole Knows.